Well, I can tell you it's really a privilege to be able to address this group. And I am totally impressed by the number of people who have devoted their Saturday to the program. I want to thank the organizers of the meeting, Brian, Mary Lou, and everybody who allowed me this opportunity to present. So first, what I thought I would do is just touch a little bit on the anatomy of how we blink our eyes. And so here you can see, this is the orbicularis oculi muscle. You can see how circular it is. It's almost like a sphincter, and then there are different parts to this muscle. One part that is particularly important, it's called the palpebral part. We call it the pretarsal section of the orbicularis oculi muscle because it has a lot to do with how we blink. But underneath that muscle and underneath that plate is this levator palpebris superioris, and this muscle attaches, and it's the muscle that's responsible for opening the eye. So we have the orbicularis oculi that closes the eye, and then we have the levator that opens the eye. And when you look at someone in a normal blink, what you see when the eyes are open, that circular muscle is quiet, and that levator keeps the eye open. When you close your eyes quietly, you have that tarsal portion, the portion along your eyelid contracting, closing the eye, and you have that levator, that muscle underneath, quiet, inhibited. And we repeat this action over and over and over as we blink normally. However, in blepharospasm, this relationship is not as well defined. I also wanted to show you, so here's the levator, it's underneath this orbicularis oculi muscle and underneath the tarsal plate. But in addition to that, we have muscles that are around the eye that are not infrequently also involved when somebody has blepharospasm. And this would include, here's the orbicularis oculi muscle, but here's the corrugator muscle. So that's when you knit your eyebrows. That's what causes that wrinkle. And then you also have the procerus, and that's when you get that wrinkle right above your nose. That's called by the procerus muscle. And then, of course, the frontalis muscle, which wrinkles up your forehead. And these muscles are not infrequently joining in many people who have blepharospasm. Now, we know that blepharospasm is a focal dystonia. So it involves abnormal, involuntary contraction of these muscles that are responsible for closing the eye. So it's involuntary eye closure that can be manifested by increased blinking in some. Some people have tonic eye closures, so the eyes squeeze shut. Some people have combinations of the two. There will be blinking and then tonic closure as well. The onset typically is in the 5th to 7th decade, so usually in the 50s. And there is a female preponderance that is estimated to be about 2 to 1. What is the natural history? We really don't know enough about the natural history of blepharospasm. The Dystonia Coalition has been devoted, this is a group of investigators devoted to figuring out what happens with dystonia over the course of time, because this has not been well described at this point. Typically, the onset can be with eye irritation, so it feels gritty, scratchy. The corneas usually go to the ophthalmologist first with these abnormal sensations. Photophobia, bright lights, intolerable. In 25% of people, the onset can be just in one eye at the beginning, but typically it spreads to involve both eyes. We think that over the course of the first 1 to 5 years is when one would see the worsening. But having seen many patients, I don't think that that's always the truth. Sometimes the condition can fluctuate where there are periods of relative quiescence of the symptoms to be followed by periods where the symptoms seem to be exacerbated. The remission rate is really a hard number to come up with. How many people get better? And we don't have that data. It's estimated that there may be partial remissions, meaning the symptoms abate somewhat, but in most people, the symptoms will return. we estimate that the permanent remission rate is probably less than 1%. The problem with blepharospasm, of course, is the disability that it causes, the visual impairment in particular. It affects about 50 to 70% of people, and in some people, the eye closure is such that they are functionally blind. So despite the fact that the eyes are working well, and the visual cortex is working well, the eyelid closure prevents people from doing the things that they need to do, such as drive, go to a movie, go to work. So it can be very functionally impairing. In some people, there is a sensory trick. So some people will notice that if they do certain movements, certain touches around the eyes will open up. And some people, when they read, they'll find that when they read, their eyes tend to open up. And this isn't true of everybody. Everybody is so different with this disorder. And the sunglasses, which is a great way to prevent the light-induced worsening of the blepharospasm. Now, blepharospasm can spread, and typically it spreads to other areas of the face, and that can occur in approximately half of the people. In a smaller percent, these dystonic symptoms may spread beyond just the face, so they may involve the neck as well and other areas of the body. So this is a gentleman, and I hope this works, who has kind of typical blepharospasm. Here you can see he's a little asymmetric, a lot of blinking, and then intermittently you will see these tonic spasms, these tonic closures. You can see the corrugator muscles causing this wrinkle, the procerus causing this wrinkle. This is, of course, after treatment. So thankfully, we have a disorder where we can approach it with a very effective therapy, which Dr. Jankovic will discuss later. Now, this is a woman who began initially with grittiness in her eyes. Then her eyes started to close, and then she developed some lower facial. You can see how along her lips, they kind of move up. We call this a cranial dystonia. And again, not just involving the eyes with the blinking, but also the upper lip pulling up, and a part of the face also pulling up. So this is an example of a cranial dystonia. Now this gentleman, and we don't call this mesh syndrome anymore, by the way. We call it this is a craniocervical dystonia. It's a segmental, meaning it involves more than one body area. And you can see his eye involvement. You can see his lower face. And you can also see that he's got some neck involvement with the chin tuck and a little bit of anterocollis. Now this gentleman was a banker. And so although this type of disorder is not life-threatening, one can understand how it can be very disabling to try to talk with someone about a loan and to have these kinds of movements involuntarily going on in the face. So that's blepharospasm. Let's look at eye closure, because I was given other disorders as well. So we're going to look at a few other disorders that involve the eyes. So one of them, this is a secondary blepharospasm. You can see his eyes are squeezed. He's got some lower facial involvement, some neck involvement. He was exposed to a medication, which could cause a dopamine receptor antagonist, which can cause tardive dyskinesia. So in his case, this is a secondary form of blepharospasm, not a primary form. This woman had a disorder called progressive supranuclear palsy. She had many other neurological findings in addition to her eyes, but you could see that she had a dystonic grimacing as well as a dystonic closure of her eyes. So you can see this kind of disorder in other neurologic disorders. Here we have he's a 4-year-old boy. When you look at him, if he's going to do it, he does have that eye squeezing, okay? But this is not primary dystonic blepharospasm, but rather an example of what we call a tic. a dystonic eye tic. Children very seldom get primary blepharospasm. That's really a disorder that affects people in an older age group. Here we have a gentleman, his eyes are just closed, and he can't figure out how to open them up. He can't open them up. This involves either the inhibition of that muscle that opens the eyes, or this could also be a pretarsal dystonia, so that the orbicularis oculi muscle that covers the eyelid is the dystonic component, leading to a quiet closure of the eyes. This can occur sometimes in isolated primary blepharospasm, but is also seen in multiple other neurological disorders, including progressive supranuclear palsy. This is a disorder we all have to be cautious of if we're going to be considering using botulinum toxin for the treatment of blepharospasm, because this is not blepharospasm. This is myasthenia gravis, which is an autoimmune disease. And what happens in myasthenia gravis is that, in fact, the eyelid muscles are weak. So it's not that they have a forced active component to them, but in fact they droop because they're weak. And typically one will see it in an eyelid. Here you see it asymmetric. Here it's bilateral. They can also get double vision or diplopia associated with this, swallowing difficulties. And the one thing you do not want to treat them with is any drug that would increase blockade at the neuromuscular junctions, such as botulinum toxin, because you're likely to make them worse. One of the interesting features of this disorder is the fatigability. So with these patients, if you have them look up and their eyelids are raised, you will notice as it stays up, the eyelid slowly fatigues and comes down. And that's an indication, again, of the weakness. This is a disorder that we see not infrequently in all of our clinics. It's a disorder called hemifacial spasm. And here what you notice is that she does have eye closure, but she's got also synchronous spasms involving the lower face. So the hallmark of this disorder is that it involves one side of the face. Rarely two sides can be involved, but typically one side. Sometimes it's associated with mild facial weakness on that same side. The onset, 4th to the 6th decade, and the disability that these people get is predominantly they have impaired vision because it's hard when one eye keeps closing involuntarily. They also get facial distortions, which makes it very difficult in a social situation because people think that they're winking at them, when in fact this is a disorder involving the facial nerve. And so the social inappropriateness can be an issue as well with these patients. This disorder is also treated predominantly with botulinum toxin, and here you can see, I got her happy, you can see that on one side, those spasms have been completely eliminated through the administration of that kind of therapy. So I've given you rather a quick overview of blepharospasm, as well as the eye disorders seen in other neurological diseases. And I would like to take this opportunity to congratulate the Benign Essential Blepharospasm Research Foundation on 35 incredibly successful years. And with that, I'd like to thank you for your attention.